This is the 2-minute warning. Reporters on the line, please press 1 to ask a question.
Well, good afternoon, everybody, and thank you for joining today's briefing on COVID-19 in North Carolina. Throughout this pandemic, we've worked to protect people's lives and livelihoods. In fact, North Carolina has ranked among the lowest states in COVID deaths and job loss per capita. In the early months when there was almost no PPE or testing and precious little vaccine or effective treatment, we put protections in place like mandatory masking and gathering limits that no doubt saved lives. And we got to work. We manufactured and mandatory protections, relying more on people and businesses to make educated choices. These efforts have worked. We've prioritized getting children safely back in the classroom. We've made available an abundant amount of PPE and testing. And we've made safe, effective, and free vaccines available to everyone ages 5 and up. People continue to get vaccinated and boosted, and 75% of adults have had at least one shot in our state. We ended North Carolina's statewide mask mandate last spring, and we've relied on local school boards, local governments, and local public health officials to make good decisions. And for the most part, they have. I'm grateful for local officials who've done amazing work to protect children and save lives under difficult circumstances. In the last couple of months, the Omicron variant of this virus overran the nation quickly. Now, just about as fast as the numbers peaked, they're falling. This variant is clearly more contagious, yet generally causes less severe illness, particularly to people who are vaccinated and boosted. And now people know how to gauge their level of risk and decide how to best protect themselves. As a result of all these factors, I encourage schools and local governments to end their mask mandates. In a few minutes, our North Carolina Secretary of Health and Human Services, Cody Kinsley, will talk about the latest school guidance from health officials on masks, their recommended path to ending requirements, and the latest COVID data. People and businesses should continue to make the best decisions for themselves, their employees, and their customers. There are still some places, such as healthcare, long-term care, and public transportation, where a mask will still be required because of the setting or federal regulations. Learning how to live with this virus is a reality we all continue to face. Some people, including me, will feel more comfortable wearing a mask when they're in crowds, for example. Parents might still want their children wearing a mask inside school. Businesses might want their employees and customers to wear masks. At this stage of the pandemic, it's right for them to make these choices in most situations. But the most important thing people need to know is vaccines provide the strongest protection against serious illness, hospitalizations, and death from this virus. It is the unvaccinated who are experiencing the vast majority of COVID deaths. We've learned how to protect ourselves and each other from serious illness due to COVID. Now we take a positive step on mask requirements to help us move safely toward a more normal day-to-day life. And I know we all want that. Now I will recognize Cody Kinsley, our Secretary of the North Carolina Department of Health and Human Services, to share an update on our COVID data and our policy changes. Secretary Kinsley.
Thank you, Governor Cooper, and thank you for your leadership. We have a lot to cover today, and so let's first take a look at our trends, and then I'll provide additional details about our guidance. The first graph looks at people who come to the emergency department with COVID-like symptoms. This is one of our early warning systems for COVID-19. The yellow line, which represents this year, shows a steep decline in COVID-like illness. That's a good sign. Next, we look at new COVID cases. This graph shows you the trajectory of new cases each day since we had our first case in March of 2020. Our first major peak in cases was back in January of 2021, before vaccines were widely available. The second peak in August and September was the result of the Delta variant. The Omicron variant drove the rapid increase in late December and early January, dwarfing the previous surges. Let's zoom in and look at just the last few weeks. On this graph, we are looking at cases from December through today. You can see that cases have come down sharply over the past month. Next, we look at the percent of tests that are positive. This graph goes back to December. Looking at the yellow line, you can see that the percent of tests that were positive was above 30% most days for almost 3 weeks, before declining to now 10.6%. While we can get important trend information from this graph, this metric only includes PCR tests. The rise of antigen testing, including at-home testing, makes this metric less reliable and one we may move away from in the coming months. Our next graph, we look at day-over-day hospitalizations, beginning in mid-December. The yellow line today, 75% of those 18 and older have had at least one dose, as have 96% of those 65 and older. we've worked hard to ensure that everyone, particularly those who have been hit hardest by the pandemic, have been able to access vaccines. In North Carolina, slightly more people who identify as Hispanic have received at least one dose than those who are non-Hispanic. We've also narrowed the gap between the Black or African American and white populations, and for some age groups, we've eliminated the gap entirely. The percentage of people receiving at least one dose is broken down by age on this slide. Those who are most susceptible to COVID-19 because of their age have excellent vaccination rates, 97% for those over 75. As we continue to better understand the COVID-19 virus, we know more about how to protect against the most severe cases. Research through the Delta and Omicron surges showed that vaccines continued to work and that booster doses provided additional protection. Of those in the intensive care unit, 95% have not received a booster. As of today, 51% of people 18 and older who have been vaccinated have gotten a booster dose. For those 65 and older, that's 70%. As we emerge from the latest surge, the COVID-19 landscape looks different today than it did 2 years ago, or even 2 months ago. We have learned more about the virus and now have several effective tools that reduce the risk for people. Vaccines and boosters are widely available and have protected millions of people against severe illness, hospitalization, and death. Treatment is available for those at higher risk of severe disease. And this week, we expanded the standing order so more people can access these treatments. And as I shared today, our trends are decreasing, lowering the risk of infection and improving hospital capacity. Therefore, as we have throughout the pandemic, we will be adapting our response based on the data and for the current stage of the pandemic. As the governor shared, if our trends continue to improve, beginning March 7th, schools and other low-risk settings can consider moving to voluntary masking at the discretion of local authorities. We strongly recommend that schools promote vaccinations and boosters for students and staff, and that schools participate in our testing program. High-risk settings like long-term care, correctional facilities, and healthcare settings should continue to require masks and follow all CDC guidelines. Regardless of the setting, you should wear a mask if you are at high risk of disease, if you have a COVID infection or a known exposure, or if you are not up to date with your vaccines. Because well-fitting masks like a KN95 or N95 provide an added layer of protection, people may still choose to wear them. There will be times when you'll see me wearing a mask, like at a crowded indoor event. My comfort level may be different from someone else's, and that's okay. Our goal is to use the tools we have so that people can all get back to the people, experiences, and places we love. The most effective tools are vaccines and boosters. Everyone 5 and older should get a COVID-19 vaccine, and everyone 12 and older should get a booster as soon as they're eligible. Our other guidance is still in place. If you have symptoms or have been exposed to someone with COVID-19, get tested and stay away from others if you're sick or test positive. Get treatment early if you're at high risk for severe illness. We're announcing these upcoming changes now so that people have time to get prepared and get up to date with their COVID-19 vaccines and boosters. As we move forward, we will remain vigilant and we'll respond to changes in the virus so that we can protect the health and well-being of North Carolinians. If you or your children have not gotten vaccinated yet, please talk to a doctor, nurse, or other medical professional, or go to reliable online health resources like the CDC or myspot.nc.gov to be sure you are getting accurate information. It is not too late to vaccinate. Go to myspot.nc.gov for more information. Governor Cooper?
Thank you, Secretary Kinsley. This pandemic has been difficult for all of us. It's been particularly tough on parents, teachers, and school children. It's time to focus on getting our children a good education and improving our schools no matter how you feel about masks. North Carolinians have weathered this storm with the resilience that has always defined us. And as we continue to shake the cobwebs of this virus and work to get more people vaccinated, our eyes are on a very bright horizon. Already, we're emerging from the pandemic from a place of strength with record jobs announcements, booming state revenues, and truly limitless potential. And I look forward to more of that in the coming months. With me today, along with Secretary Kinsley, is our Director of Emergency Management, Will Ray, our Department of Public Safety Secretary, Eddie Buffalo. We also have Dr. Susan Consagra, who is with us today. And we also have Jackie and Jasmine Mativier, who are our Spanish language. Ms. Dawn.
Okay, it's winding mine up. Does the governor, does this affect the state of emergency at all as far as timeline on that?
So that is still in place. We are continuing to evaluate it. It is providing much needed flexibilities to our hospitals and medical providers. It's also helping us get vaccines to people in a faster, more effective way. We may talk with the legislature about putting some things into law permanently so we can consider ending that. But right now, that's where we still are.
And then, do you mean about like what the hospitals need and if some
That's
legislation
right.
passes?
I mean, I think with this pandemic, there are a lot of things that healthcare has had to change in the way they approach things. And we've had to have more flexibility for healthcare professionals to be able to cross over and do things they need to do that they, under the statute, might necessarily have the authority to do, but everybody pretty much agrees that they can do. And that is what the emergency order has allowed them to do. So we hope that we can get some permanent changes in the law to help us respond to this pandemic and future health situations like that.
Do you, I mean, it's been up to the school boards, but what if the school boards don't want to lift the mask mandate come March 7th?
Look, I think local control is important here. And we passed a law, the legislature passed a law, and I signed it, giving local school boards control of this situation. And I think they should continue to have that control. Today, I'm encouraging them to end mask requirements. I think most all of the school boards are going to consider it. And I think that's an important thing for them to do.
So like just as you started talking, I think the Senate took its vote on the school's mask bill. Does that mean that you'll sign that legislation when it comes to
I
your
don't
desk?
even, I know that they're looking at something today and that they're very frantic about it. From what I know about it, I have concerns that it's unwise and irresponsible. I mean, are we going to let people pick and choose which public health rules are going to follow? I'll review it if they pass it and I see it, but I certainly have concerns about what I've heard.
Why, if this is local control, why do you feel the need to say something today for like the mayors or like county officials across the state that still have these that are listening and the school boards, if it's up to them anyway? Do you think they just need that to hear that from you, or what's the reasoning behind saying that?
Throughout this pandemic, health officials have evaluated where we are in this pandemic, looking at the data and updating their guidance. The school toolkit provides guidance for schools, and it has in the past strongly urged mask mandates for the local schools, and that's been the right thing. That's been a positive thing. But we're at the point in the pandemic where the health officials say that lifting those mask mandates may be the right thing for them to do and that they should consider that. So we believe that they will look very carefully at that guidance and I think make those positive decisions that will not only help us refocus on learning and getting our schools where we want them to be. I know it's been so tough on parents and students, and all of them are frustrating. And we want all frustrated, and we all want to make sure that we can get back to day-to-day living and normal life as soon as we can.
Is the March 7th date, I mean, look, that's like if somebody their kid isn't vaccinated yet, and is that the timeline related to that with the being able to have that, or is it just so the boards can meet, or what's the timeline there?
So a lot of local governments have already done away with their mask requirements. A number of school boards have done away with their mask requirements. They have the authority to do that. I'm going to let Secretary Kinsley talk about why their recommendation is worded the way it is. So, Secretary Kinsley.
Want to have with our new updated guidance as they navigate and consider those decisions. But as the governor said, we strongly encourage for them to take this step forward.
I have one more question for you, Secretary, and then I'll pass it to Jonah. On a different topic, the labor shortages are especially acute at DHHS and especially in certain areas. What's your plan for addressing that so the workers that are still there aren't looking to leave or work somewhere else?
Well, thank you for raising this and for your focus on this issue. This pandemic has been incredibly treacherous for our healthcare workforce who have been on the front line since the beginning. And I'm so grateful to them. And I'm grateful to everybody in the state that has stepped up and taken a vaccine as a strategy to help protect those healthcare workers as well. In our facilities, as you know, we've seen a skyrocketing increase in our vacancies, especially in our nurses. We are working aggressively to try to support them every way that we can with every flexibility that we have. But this is going to be an important issue for us to work on in the near term, but also for the long term. We were on borrowed time in North Carolina around our healthcare workforce. We had a lot of individuals ready for retirement. This is a big priority for me looking ahead. Building a strong and inclusive workforce is something both for our healthcare workers, but broadly in the employment sector.
What should they know today, like of any sort of changes that are coming?
Well, I think that we're going to continue to work with boards and the legislature to have conversations about what we can do to support them. And we look forward right now to hearing from our local hospitals and our long-term care facilities about what they need to support. I mean, in the short term, a lot of the flexibilities that we've already put in place as part of the pandemic response that the governor was speaking to are helping. We want to make sure we don't lose those as we continue to move forward.
Thank you.
Thank you.
Yes, Jonah.
Governor, Secretary, Dr. Jonah Campbell with ABC 11. Governor, first question for you is, as you mentioned, there has not been any statewide requirement for many months. You delegated this to the local officials, city councils, county commissions, school boards. You could have still done that. What was it, or what was happening that you decided to put your thumb on the scale with this announcement today?
Well, health officials have been making recommendations to school boards all along. And in fact, the toolkit has been very detailed about what schools ought to be doing, and it still is. There are other safety precautions that schools are taking to keep teachers and students safe. So masks just one of those issues. And it's one that I think it's time to end those government requirements on masks, and I believe that most of the local school boards will do so.
I want to give you an opportunity for some clarity here because you mentioned March 7th as when the toolkit is going to be updated, where you encourage all schools to lift their mandates by March 7th. What about for the city councils, the county commissioners? Do you want them to roll back their mask mandates right now? Should Raleigh Mayor Mary Ann Baldwin make that announcement tonight? Should she wait till next week, next month?
So local governments already are making those decisions. The toolkit is being updated now, but I'll let Secretary Kinsley talk about again the March 7th date.
Thanks for the question, Jonah. The March 7th date will be when we update all of our guidance. We'll be updating our guidance for schools, as we mentioned, and also childcare, but also for local governments. We'll be recommending for the general public that right now universal masking is not the strategy, that vaccines are our most important strategy in those settings. And I want to be very clear here that we'll be keeping in place, especially in high risk settings, the importance of universal masking, healthcare, long-term care, et cetera. So we're tying all these things to March 7th as we watch our cases decline and giving people time to get vaccinated and to have conversations about what to do for their local communities.
And Secretary, if you can also clarify, you just mentioned about childcare. So for preschools and early education, this same guidance will apply for K-12 schools and for preschools that encourage optional masking no later than March 7th.
Yes.
Dr. Consagra, right? Okay, thank you. If I can ask you, because one of the things that we're hearing or that I've heard from health officials, they look at the CDC guidance. Now, we heard earlier this week that the CDC, they're talking about updating their guidance, but as of right now, they haven't done that. So why are you confident? Why are our
the levels by which that cases per 100,000 metric doesn't strike as meaningful in this current moment of the virus as before, which is why we're moving in this other direction as we look at all of our trends and all of our tools in concert. But let me have Dr. Consagra speak a bit more about cases.
Thanks, Secretary, and thanks, Jenna, for the question. Yes, the CDC is also looking at their guidance. We know certainly what we have learned from Omicron in these last several weeks is that Omicron is a less severe virus. We're seeing milder illness. And because of that, actually looking at transmission is now shifting to really looking at disease burden. And that's one of the things CDC is looking at. How much is this impacting our health systems? How much are we seeing hospitalizations? And that's really the shift in metrics that are going to happen. And that's really where, as we think about our guidance, we are seeing, again, positive trends. Our hospitalizations have come down by almost half in the last several weeks. And certainly our cases are coming down rapidly as well. So for all those reasons, we are seeing trends moving in the right direction and continuing to move. And at the same time, we know vaccines and treatments are available. And we are seeing more and more, especially around our treatments, accessibility. And so those are all trends that are moving in the right direction for us to make this change.
If you bring back, you went through that data metrics slideshow. One of the things I noticed was there was quite a curve with vaccinations. The younger the demographic, the less vaccinated they were. Can you talk about the strategy now for reaching those younger Americans where many parents feel, as you just said, thank God, it's not really a pediatric disease. What is the case for vaccinating if it maybe doesn't reduce transmission and most able-bodied, healthy children are not getting severe cases?
Well, I'll turn this over to Dr. Consagra as well, but just to again emphasize that for all individuals 5 and above, that vaccines are both safe and effective. And what we know from our research and in having conversations with parents, that the continued emphasis of making sure that vaccines are available, especially in their doctor's offices as they have conversations, is incredibly important. And so we'll stay focused on operationally ensuring that those products are available there as we move forward through this. But Dr. Consagra.
Thanks, Secretary. And that's absolutely right. So, we're doing a few things. One is obviously, again, continuing to emphasize vaccines and boosters for those that are around children that are not eligible yet, and certainly for 5 and up, continuing to encourage vaccines and booster. And the other thing is really ensuring that our pediatricians have the ability to administer COVID vaccine in the medical home when a child is going in for their visit. And that's really important because we know pediatricians are a trusted source of information for parents. They're one of the places where children already go for routine immunizations. And so we are working hard to make sure pediatricians have a vial in their fridge so that they are ready to administer the vaccine.
Why do you think that percentage is so low, especially for that demographic, the children above 5? Is the message not resonating? Do people not think it's necessary? And if they don't think it's necessary, what's the message to them? Why should it be necessary?
Yeah, certainly we are seeing lower vaccination rates in our younger age groups, and that's where we are doing work to make sure that again that parents are getting that information from trusted sources, and one of the main trusted sources is pediatricians, and so we are providing that information. It is really important in that age group because we know while they have lower risk of severe illness that does occur from time to time, and certainly we are also seeing other impacts like long COVID, and those impact children too. So it's still really important to get children vaccinated. We're continuing to share that message. We want to make sure those trusted partners like our pediatricians have that information and can continue to provide it.
Governor, last question for you. I probably don't have to ask.
Let me add
Oh,
one
go ahead.
answer
Sure.
to that. The vaccines for children started later. I mean, we had the vaccines come out early in 65 and over, the most vulnerable. They've been getting vaccinated a long time. It's been later on in the process where vaccines have been approved for younger children. So we're going to work really hard, as Dr. Consagra and Secretary Kinsley said, to make sure we get people vaccinated, and particularly our younger people. But go ahead.
Sorry, I was going to make a quip about, I probably don't have to look at your inbox to know the pressure you've been under. I'm curious, you're the chair of the Democratic Governors Association. Did you have conversations with your colleagues, Governor Hochul in New York, Governor Wolf in Pennsylvania, or some of these other places, Governor Lamont in Connecticut, or I think Governor Pritzker in Illinois? Did you have conversations with these fellow Democratic governors? And what did they tell you if you did have these conversations?
So I'm on the phone with governors of both parties frequently, usually at least once a week. And yeah, this is one of the issues that has been talked about is mask mandates. So we have another question, I think, on the phone.
Our first question is from Ashley Pally with WRAL.
Hi, thanks for taking my questions. I just have two. I've heard multiple mentions today of making sure people are up to date on their vaccines, which I think DHH clarified for us this week means boosted. So with that, I wondered if you were going to revisit your executive order for state employees to be vaccinated. Will they be required to be boosted as well?
So first, we want people who are eligible to get a booster to get a booster. The evidence is overwhelming, particularly with this Omicron variant, that if you are vaccinated and boosted, that you have significantly more protection against serious illness, hospitalization, and death. So let's start there. Secondly, we are looking at the state employee requirements. We are doing everything we can to encourage people to get boosters, and we'll consider that as we go further and get input from health officials. And I don't know if Secretary Kinsley would want to comment on that, but I know that he has been working with us on that issue. Next question.
Follow-up, Ashley Pally with WRAL.
Thank you for answering that. And this question might be more for Secretary Kinsley, but you said that you all are probably going to phase out the positivity rate as one of the measurements that you're looking at. Since there are so many at-home tests going on, do you think that is, do you think we're seeing a lot of positive tests coming from those that, are not being reported to the state?
So I know that testing is important in the fight against this pandemic, and we're going to continue to encourage testing, but I'll let Secretary Kinsley address that question specifically.
Yes, thank you for the question. As we outlined, there's a number of metrics that we look at and really trends across those metrics. There's not going to be any one that is particularly more valuable than another, but looking at across all of them in concert. And at the same time, looking at our supply of vaccines, our supply of treatment that help us understand how best to respond in each phase of the pandemic. To your point specifically about cases and testing, while testing is an important tool for you to know how to maybe change your behavior at home, yes, we're at a place now where a lot of the at-home tests are not being reported to us. And so that while we get some information from that trend line of the test overall, it's not as important to us as other metrics such as our COVID-like illness, syndromic surveillance in emergency departments. That's more of a passive metric. Or even, North Carolina is one of a few states nationally that's invested in building out wastewater monitoring, another passive metric that allows us to get a sense of the trend and directionality of COVID in our communities. Those metrics give us really early indications, along with hospitalizations and tragically deaths, to get a more holistic view that's a little easier for us to get the picture of everything. Thank you.
Next question, please.
Our final question that will conclude today's media briefing is from Samir Nesby with WLOS.
Hey, thanks for taking my question. Governor, I guess now that we are starting to see COVID-19 restrictions somewhat lift and the metrics going, or at least trending in a positive direction, can we say we're starting to enter an endemic phase? What is your team really saying about that?
Well, I'm going to leave that to the secretary and the medical profession, but we are getting in a better and better place here with this pandemic. And the thing I think is so important is we know how to protect ourselves. We know that vaccines and boosters are the best protection, but everybody's familiar with things that you can do to protect yourself based on what layer of risk that you have. And so we're going to continue to educate the public, continue to work on getting vaccines. And I'll let you comment, Secretary Kinsley, on what kind of phase we're in.
Thank you, Governor, and thank you for the question. Endemic is really the concept of being in equilibrium or balance over time. Right now, as we have seen with COVID, there can be curveballs and variants that really create pushes in different directions. We are moving in that direction over time, but we still have more to learn. Information that they need to protect themselves, of course, starting with vaccinations. And then as we continue to learn more about the virus, we'll be able to get to other phases. Thank you.
Thanks, everybody, for being with us today.